In this episode, we're going to talk about metabolically healthy obesity and metabolically unhealthy obesity. These are the terms used to describe different metabolic profiles in people with obesity. Despite similar BMI, these two categories differ significantly in terms of their risk for developing obesity-related complications such as cardiovascular disease, type 2 diabetes, and other metabolic disorders. Individuals with metabolic healthy obesity can have BMI in the range of obesity, but they do not exhibit the metabolic complications typically associated with obesity. They have normal blood pressure, so no hypertension, normal insulin sensitivity, so they are not borderline diabetic or diabetes, normal blood glucose, and cholesterol. This is characterized by lower levels of visceral fat. So you may have high peripheral fat, the fat that you can pinch under your skin, but there is less fat around internal organs, which is more linked closely to metabolic disorders. Metabolically healthy individuals typically have more subcutaneous fat, and they have lower levels of inflammation. Inflammation is the key factor in the difference of how metabolically healthy individuals are and the metabolically unhealthy individuals are. They tend to have lower levels of inflammatory markers. Better insulin sensitivity allows for better glucose regulation. Although these individuals are at a lower risk for metabolic complications than their metabolically unhealthy counterparts, but they are still at higher risk than individuals with normal body mass index. Over time, these individuals can transition to unhealthy obesity. Now let's talk more about metabolically unhealthy obesity. These are the individuals with BMI in the obese range and having metabolic complications like elevated blood pressure, fatty liver, high cholesterol, borderline diabetes, elevated fasting glucose. The metabolically unhealthy obesity is characterized by higher levels of visceral fat. They are more likely to have excess fat around the internal organs. That contributes to metabolic dysfunction and chronic inflammation. It is also associated with higher level of inflammatory markers, which contribute to the development of metabolic complications. Insulin resistance is a big part of this metabolically unhealthy obesity. Insulin resistance is more common, leading to higher risk of type 2 diabetes and cardiovascular disease. Individuals with metabolically unhealthy obesity are also more prone to develop obesity-related complications. Understanding the difference between the two different types helps us in tailor the medical and lifestyle interventions. While metabolically healthy obesity might suggest a lower immediate health risk, it does not mean that there is no risk at all. Both groups can benefit from lifestyle changes such as improved diet, increased physical activity, and weight management to reduce their overall health risk. From the treating obesity standpoint as a provider, I see it as a spectrum where metabolically healthy obesity is the right time to intervene and prevent metabolically unhealthy obesity. Our goal as physicians is to intervene before the microvascular damage starts. So our goal should be to intervene when we are still at the stages of metabolically healthy obesity. I hope this made sense, and if you have any more questions, please go to my website on weightandmetabolism.com.